Welcome to Connections with Deborah Turner. I'm your host and publisher of Natural Awakenings magazine for Rockland and Orange counties, Natural Health and Green Living magazine. And in the December issue, the theme is Awakening Humanity, so you can pick that up if you haven't yet done so. And our theme for January will be health and wellness, and today we will be talking about health and wellness. So I'd like to welcome Jen Servidio of Feel Better Bodyworks, who's a massage therapist. So welcome to the show.
Hi, Deborah. Thanks for having me.
Sure. And I just want to preface by saying that Jen is a great massage therapist. That's who I go to. And she always finds these spots I didn't even know were causing me problems, and she makes them better. And so she's just really very good, very intuitive, and very caring. So just wanted to start with that.
Thank you so much. That really means a lot, actually. So I appreciate that very much.
Sure.
Thanks.
I thought we could start a little bit of how you first got into massage.
Actually, I'd love to start that way. The real reason that I got into massage was because I had shoulder pain from waiting tables for many years, and it just wasn't going away, no sense of stretching or anything. And I met a therapist that was really informative, and she did a lot to help me physically. And we started talking about careers, and she had a really nice little lucrative business going, and I was at a point where I needed to find something that was a bit more stable. I wanted to I was getting married, and I wanted to have children, and it was important for me to be home with them, so I needed a business that would be able to be flexible, to allow me to be a mom, but also to, really give back as well. I wanted to do something that had meaning, and she helped me so much that I wanted to be able to reciprocate that, in some way to somebody else. So so that's pretty much how it started. She supported me and gave me a bunch of books and showed me around to some schools, and she was just really it was a positive mentor to have in my life, so I was very fortunate to have met her.
And it sounds like at the right time as well.
Completely,
so, yes.
Always at the right time.
Right.
It worked out well.
And I thought part of it was you had shoulder pain, and so on. That also kind of helped you figure out that it was massage. That was
yes, it was. I mean, she was able to do things to my shoulder that I didn't even think you could release. Like you said, you didn't even know that you had those spots that hurt.
Right.
And all of a sudden, I'm like, wow, okay, that feels so much better. So it was really nice to see the effects of good therapy and what it could really do to help with all sorts of issues. For me, it was just chronic pain, tightness, stiffness, lack of mobility. And she took care of that, and it really didn't take super long, a couple of sessions over a few weeks' time, and our shoulder just started to loosen up really beautifully, and I was becoming more and more inspired with each time I got to meet her. So so the change had occurred, on many levels. So it worked out well.
Right, your shoulder is better, and you had a new career. So
absolutely.
And there's so many benefits to therapeutic massage.
Absolutely,
and you
there
just
really
mentioned a few, but if you can talk about it a little bit more, and because there's just the massage, like people just sometimes have this image of it's just go and the pampering thing, but there's so many health benefits.
There absolutely are. I mean, just in a general healthy person, you can reduce any kind of stress. I mean, we're all walking around with stress. It's the number one main factor in all of our lives. So just to be able to give yourself that hour, maybe once a week, that's ideal. At least in my eyes, that's ideal. To be able to come once a week and, to just relax and let somebody unconditionally take care of you and work out all those spaces that you didn't know you had, and get rid of that shoulder tension and the neck tension. So stress reduction, number one, without a doubt, which leads to feelings of peace and contentment and relaxation, which can help sleep issues. It can help digestion issues. I mean, when you're stressed, your body is not in balance. So there's so many things that will benefit by just allowing that time for your body to come to a quiet place and to reestablish its center. But not only stress, there's increased joint motion, there's increased mobility, there's reduced inflammation, reduced swelling. Excuse me. I know a lot of people, especially like if you're sitting at a desk for a long time, sometimes like your legs will get achy or your feet will swell, and so massage for that to reduce all that is also very helpful. Prenatal,
yes.
That's a very important aspect of your prenatal care. It just helps the mom feel better, which ultimately makes the baby feel better. I do work with a lot of the aging population, so all of those reasons I just talked about are beneficial to them as well. And it really doesn't matter the age or the or the condition that the person's in, providing that the therapist is taking into account the health of the person that they're touching.
Yeah.
I mean, the main benefit is you're being touched with the proper intention to bring peace and comfort and care and unconditional care. And I think from that point on, all things are possible. You know, I mean, it's just nothing but good stuff from there on, no matter what the specific treatment you're going for. You know, there's so many benefits. So,
well, one of the things that you say you do is, customize massage therapy so that, there are a lot of different modalities and types that but, you can mix it all up for
Right.
that hour or something, and really, figure out what that person needs and based on their age, certainly, and their health history and
Exactly.
what they're going through if they have some illness or whatever. So, so you can really just find what exactly is going to work best.
It's
for
funny
them.
because when we were in school, we were kind of taught, well, there's Swedish, there's deep tissue, and they do teach you that for a specific reason, so you can learn those specific techniques. And then, if you go to a spa, sometimes you'll see that it's priced that way too. Well, for me, everything gets stuck in my head, or as they told us in school, it's in your toolbox. So
Right.
I can't actually separate it too well, like, oh, that's a
Right.
Swedish massage move, I should do that, or that's a deep tissue massage. It's more like I meet the person and I tell them, I'm going to listen to what you say, but I'm also going to listen to what your body says, because at that moment when I come across a spot or an area or whatever the situation might be for that client, that particular move may not fit if you're just going with a Swedish routine or a deep tissue routine or whatever the case may be. So I
Right.
kind of use whatever I've been taught over the years that I've been working, and a lot of it's intuition and a lot of it's listening to the client, and then you just kind of grab the right modality or technique at that moment and go from there. So I just
Right.
find it to be really effective, and my clients seem to be really happy with the work, and they call, so
Right.
that's a beautiful thing.
Right.
And it's just really nice to be able to be in this profession. So it's an honor.
Right. And can you explain a little bit about what some of those types are, like the trigger point, myofascial, some.
Sure. Deep tissue, for one, is basically you would be going, you would warm the tissue up first, and then you would go in with a very long, steady, deep stroke, because you're trying to get the underlying muscles affected. Myofascial is more of a, to very briefly say, it's more of like a separation, if you will. There's something in between our muscles, in between all of our muscle fibers, and essentially in ourselves is something called fascia, and that gets a little bit stuck at times. So you'll do something called finger rolling, which is kind of a separating the skin from the muscle. It doesn't feel as horrible as it sounds. It's very gentle. Then there's trigger point, which is what happens is, very briefly, is the nerve synapse doesn't fire correctly. So in trigger point therapy, or neuromuscular therapy as it's also known, you would basically, in that general area, use a pressure on for 5 seconds, take the pressure off for 5 seconds, and what you're doing is it's essentially resetting the muscle fibers, kind of like you would reset a computer. You're rebooting it, you
Right.
know, and on certain occasions you can actually find the exact spot that happens. Very good people can feel them instantly. I'm almost that good. I generally treat the area, and that seems to work for the long range, or at least the short range goals. Prenatal is specifically for what's going on with the mom and the baby. You know, there's two of them on the table now, so you need to take into account that there is there's different things that you should be doing. That lighter touch, you know, you're not. It's the same with an aging population. You know, you're not again going to do a deep tissue move or a lot of trigger point moves on somebody that's 92 years old. You know,
Right.
you're going to take into account that they have a different type of body structure. Swedish is a very relaxing type of moves. They're very long moves. They're slow. They're gentle. You're not going to really. It's not as therapeutic as, say, something that if somebody comes in, like for example with shoulder pain, I'd probably warm up the tissue with Swedish moves and then start doing a little more of the other different types of techniques. You know,
Sure.
for an athlete, you're going to do some sports massage, which is a lot of compression. There's some vibration stuff. You know, you're going to do moves that are more quick. You know. they're going to get more blood flow to the muscle. So especially depending upon when they're coming in, before or after their exercise or their event, there's a lot of factors involved,
Right.
without having to go through every course I've learned. That's pretty much the gist of it.
Right. Right. And that's why it makes so much sense to do the combination, because, you're kind of almost in some, Swedish is almost like prepping for something else that's a little
Yes.
deeper that might be needed. And
Well, much like the
so-
body, they're all intermingled.
Right.
You can use them for everything. And each muscle is different.
Right.
So, like you said, depending upon what the person is presenting with, you would make that decision at that time, or at least that's how I do it.
Right. I know one thing that I wanted to touch on is also the reflexology, and how that can also be like really good, especially if there's like areas of the body that can't be touched for some reason. The reflexology can
Absolutely.
help the spots anyway.
Folks that suffer from fibromyalgia or MS, any of the nerve disorders, sometimes it can be really difficult to be touched, And again, with the older clients as well, their skin's more frail or a little bit more fragile, I should say. So reflexology is excellent because everything, the ears, the hands, and the feet are like little roadmaps to the rest of us. So it's really very cool to work through the reflex points to be able to relieve back pain by just working the feet. So if time permits, I always try to incorporate a little bit of reflexology into every session, just as a bit of an added bonus. If I could give everybody an extra free half hour of reflexology every time, I would love it, because I think the feet are great. There's just, it's one of the most neglected parts of our body is our feet.
Well, and that's the one that we often use the most, walking on them constantly.
And they hold a lot of stuff down there. So, if anything you learn today, learn to take care of your feet. Put them up at the end of the day. Be nice to them, because it will affect the rest of you so much so.
Right. And then also going in with, mixing modalities, also where you work has a couple different types of
Yes.
practitioners, which also, again, gives that benefit of that, people might need multiple different things. So,
Yes.
So you work with a chiropractor.
Yes, I
and
do.
an
I work at
acupuncturist.
Katoric Chiropractic and Healthcare Cooperative. We're in Valley Cottage. I work with Dr. James Katoric and also Leona Ogodevin, and she's our acupuncturist. He's our chiropractor, and we make a very unique little family. We've got Barbara and Deb in the office, and I couldn't be in a better spot. I really couldn't. I'm very comfortable being there, and we all work really well together, and we consult with each other as needed, and we do what's right for the patient and the client, really, and if they do need, if it's something that I don't feel is within the massage guidelines any longer, refer them out, because it's about getting people to feel better and to live healthier lives. It's not so much about just come to me because we should, okay, you've come to me and I did what I could, and now we need to send you on so that you can reach your full potential. So it's nice to be able to work with other professionals that are of different means, so that we can really give a total experience for the client and patient.
Right. And I also like the fact that, you've said it before, and I've experienced it, of that little mom instinct of yours also kicks in, if you want to take care of it beyond
I'm
just
a
for the hour,
caregiver.
you want to make sure that, everyone's like eating well, and, just, and because everything's all connected. And
It's so true, and I can't help it. I've been a little mom my whole life before I had my two beautiful boys and was married to my amazing husband. So I can't help it. Massage to me is such an intimate moment. You're trusting this person to touch you, and that is a very honorable thing for me. I am so grateful and honored that you and my other clients choose to lay down on my table and to let me do this for you and to let me be a part of your lives in an intimate way. So I can't help but worry and make sure that, like you said, you are eating and sleeping well, because that does all have such a huge effect on how your muscles are, how your body is, and how you are as a whole. There's three facets to us, I think. It's physically, mentally, spiritually, and all those need to be taken care of, and they need to be nurtured, in their own ways. But that's what makes a solid, balanced whole in my world, in my opinion.
Right, and massage is a way to kind of take that break and focus on yourself and to recharge, so that you are then able to go off and do whatever it is you do, and in a better
Absolutely.
better way.
Absolutely. Yeah, it's something that we should all do for ourselves. And even if you can't go and get a massage, so to speak, to go find that moment, just like I was saying to you before, just to be able to come down into Nyack and walk around for a few minutes. It was just so nice to watch people do their thing and, sit and have a cup of coffee and just relax for a minute. And I have to follow that advice myself a little more.
Right.
And, but yeah, just to take a few minutes out, but massage would be the most ideal way to do that for sure.
Right. And we've talked about the importance of touch, and that goes from like kids, babies, all the way up through the elderly, and it's soothing for everyone. So
yes, absolutely. And the main point I'd like to make there is that it's your intention. Intention is everything. When you touch somebody, you should always be coming from that place of love and compassion and the desire to bring comfort, and because there's so much energy and power in that touch. When you hold a newborn baby, you want to make sure that they feel that unconditionalness, that you're going to protect them from everything, and some of that should transcend to whoever you touch during the course of your day, even if it's a stranger, or light tap on the arm or whatever. But I think if we had more of that, you never know what could come of it, A little bit of kindness goes a long way. But especially in my line of work, it's important to always have the proper intention, and for other caregivers besides massage therapists and other body workers.
Right.
So it's important.
Right. And part of what you do is you volunteer, correct, with Tender Touch?
Actually, I just work in a collaboration with them. Yep,
Okay.
for Tender Touch for All, which is a nonprofit that tries to bring more body workers and massage therapists to nursing homes and senior residencies. I particularly work with Alzheimer's and dementia patients over at Hearthstone, and I'm loving every minute of it. They're such a great group of people, and it's, again, for me, it's an honor to be able to go there and to just be with them and to offer a little bit of kindness to them, and I actually was asked to help show the staff a little bit about what I do, so the massage is spreading, and I love that,
That's
so
great.
that they get a little bit more, because frequency is important,
Right.
It's great that you can go for a massage every 6 months, but honestly, if you could do it more frequently, go for it.
Right.
Somebody will be out there to massage you, because it is about keeping it up and making sure that all that good work that you're doing to yourself maintains, because that's
Right.
all going to promote a healthier, balanced lifestyle. And, along with good eating habits, good sleeping habits, you're in top shape by then.
Right.
So,
Right. And I think it's especially important with the elderly population who, might not have those opportunities as well,
Yes.
to be just touched in everyday life,
yes, just touched.
to, that, to have something like that. And,
Yeah.
and to then be, working with the staff so that they can then,
Continue to work.
and even if it's a few
Absolutely.
minutes, it's still, I think.
Yeah, it
has
doesn't have to be the hour,
Right.
just a few minutes every day, or over the course of the day, a few minutes here, a few minutes there, just to reach out, keep everything flowing and open and, we're balanced, really, again, it's that word balance that keeps coming up. But yeah, it's the older population or the elder population, they generally aren't touched as much as they should be. And, that creates a lot of feelings of isolation and depression and sadness. And, if I can do a small part in helping that shift a little, I feel that I'm in the right place for that, and,
Right.
and I enjoy them. I enjoy listening to them and
Yes,
listening
yeah,
about
they're
their
great
life.
stories.
And yeah,
Yeah.
it's just it makes me feel that I can handle this life. They did. They
Right.
did okay. So
Right. Well, I love that you were saying to me before that, it's like they seem to be going through all the same issues that we're going thugh now. It's just, we kind of have that technology component maybe added in, but it's
Yes.
still the same concerns and worries. And
absolutely, absolutely. So it's nice to be able to relate to them,
Right.
and also hear what their solutions were, because sometimes when you look at your history, you can find your future,
Right.
So to be able to hear, well, how did you solve that? That's why I loved working with my grandmother, and my grandmother was just the most amazing woman I've had the honor to know. And before she passed away last February, I was able to go out to California for a few days and really work with her. There wasn't too much, strenuous massage going on. It was more like the occasional foot rub, but it was more of a companionship, a lot of Reiki. I would just sit with her and just let her just be, and just be with her. And it was so eye-opening to me because it really made me appreciate, like here's this confidant that I've had that has been with me for so long, who has guided me and nurtured me, and she was just such an important part of my life. And then to know that she was going to move on and to not necessarily replace that relationship, but to be able to give that way to other older people, because I realized that not having her in my life was something that I was going to miss. I was going to miss saying, well, how did you handle it when you were 30, and so that really is that's part of my inspiration for focusing and just enjoying my time with the elder clients. So
one of the things you just mentioned is Reiki, so if you can also talk a little bit about that as well.
Well, very briefly, Reiki is it's energy work, really. It's energy therapy. And I always get the definition wrong, but this is how I explain it to my clients, is essentially that it's the energy that's around us. It's, if you will, it's like God energy. So the person that you're touching, you become a channel, and that person pulls the energy from the universe into themselves as they need. And it's only used for good. So it's never a negative thing. They're not pulling, quote unquote, your energy. You're more of a channel. And it's just so peaceful, and it's so beautiful to be able to share that with somebody else, and to be in a room with other Reiki practitioners, and to, I'm sure yourself have been able to have that experience where everyone else is tuned in, and you can kind of share that energy yourselves. And so I love that work. I absolutely do. It's so peaceful and calming, not only for the client or for the friend or the family member, but for me, it's a nice way to, on those nights when I'm not being able to sleep, and I can just give myself some Reiki, and it's like, oh, okay, now my brain's going to start quieting down, and I won't have to worry about the 100 things that I have to get done tomorrow, So I do utilize that, of course, with permission as needed, but I find it to be a really useful tool, and especially, again, with the older clients, because a lot of them that are dealing with Alzheimer's and dementia, they're confused, obviously, and they're having trouble, and they get a lot of emotions that are very hard for them to deal with. And my own children are 6 and 4, and they're also going through some confusion with their growing and the huge emotions. And so on both sets of the spectrum, I'm able to provide some sort of relief, or at least give my best attempt at providing some relief to both of them, so that I can be useful and hopefully, give a little unconditionalness that way. So, but Reiki's a beautiful technique.
Right. And we're almost out of time, so I just wanted to kind of briefly go through, like, what are some of the most common things people come to you for? And
most commonly is neck and shoulder pain. Then it would be low back and mid-back pain. And then probably leg pain would be about it. I have had people who have come with specific situations and specific conditions. But basically, I would say shoulder and neck pain is what people are dealing with, because everybody's hunched over at a computer most of the time, and they need to stand up and stretch.
Right, and that's also where a lot of people hold stress as well.
Yes, so. Always, So, yeah, I think that would probably be my my top. Shoulder, neck pain, for sure. Migraines, lots of migraines.
Oh, really? Okay.
Yeah. A lot of headaches, sinus stuff. But that all kind of comes into play, when your shoulders and your neck is tight. So we do a lot of that. A lot of getting rid of all that. Chiropractor and Leona too, So it's a lot of work, but I love my job, and I love what I do.
And it's clear that you do.
So, yeah, I'm blessed. I'm very blessed to be able to be doing this work. So.
Great. And if you can also just let people know how they can reach you.
Oh, yes, thank you. Well, my company's called Feel Better Body Works. My name is Jen Servidio. My number is 845-721-9643. You can either reach me at feelbetterbodyworks.biz, which is my website, or my email is feelbetterbody@optonline.net. And I'm located at 217 Route 303 in Valley Cottage, under the Couture Chiropractic and Healthcare Cooperative sign. So,
well, thank you so much for being my guest today. And
thank you for having me.
Great, and I look forward to connecting with everyone again next week.